She became a doctor at 12 years old, just so you know. All right, so what's the upshot here?
Well, all right, you need to look at this. Proposition 65 is talking about the risk of caffeine on cancer and on birth defects. So let's break it down. Does caffeine cause cancer? Lots of data shows it reduces the risk of cancer. It does not cause cancer. In fact, the American Cancer Society says moderate use of caffeine is not a risk factor for cancer. So we've ruled that out. Now let's look at birth defects. There are some small studies that show there may be, at very high doses, an increased risk of birth defects. But the American College of OBGYN, Obstetrics and Gynecology, states for pregnant women they can have up to 6 to 7 cups of soda per day. So
soda containing caffeine?
Soda containing caffeine. So,
yeah, but won't your kid come out like buzzing?
Well, it does cross the placental barrier. So your child, when you do drink caffeine, will have some caffeine effects. But if the American College of OBGYN is stating that moderate intake of caffeine is allowed in pregnant women, you've got to really question.
Well, Doc, I'd say they're running with this in California.
Pardon me?
They're going to run with this in California.
I think it's very, very controversial.
Well, do you as a doctor, you don't tell your patients have extra caffeine, do you?
Do
you really?
Caffeine, I would say, if you have to pick your vice,
all right.
If you have to pick your vice, I would pick caffeine. So many studies show that caffeine actually has a lot of health benefits. It can actually improve diabetic control, decrease
caffeine
risk. Yes. Something about the antioxidant properties may increase your insulin sensitivity.
But you can overdo it, right? I mean, let's say you're having 10, 15 cups of coffee
This is a fun topic. Caffeine, in a lot of studies, Parkinson's disease, cavity prevention, migraine control has shown that higher doses actually work better for these problems.
Do you think if you have a lot of caffeine, then you can have a lot of sweet things like cakes and just...
Not related, Neil.
Right. I was pushing a doctor.
I'm sorry.
Just wanted to see how far we go. All right, doctor, very good seeing you. I hope you have a Merry Christmas.
Thank you. Merry Christmas to you.
All right, have a lot of caffeine.